Good evening, America. It is 7 p.m. Tuesday, May 19th. It is time to queer up the news. We are literally out of the closet and into the headlines at Q News Tonight. So many of your stories we are going to tell tonight, and we begin with breaking Q news. Donald Trump reveals he is taking hydroxychloroquine, contrary to FDA guidelines. We've prepared what he has said. It's amazing. Watch this.
I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it. I'd like to take it. A lot of people are taking it. So I'm taking the two, the zinc and the hydroxychloroquine. I'm taking it, hydroxychloroquine.
When?
Right now, yeah. And all I can tell you is, so far, I seem to be okay.
Well, he shouldn't be taking it. I mean, his own FDA has said that this is still something under investigation. It should not be taken outside of a clinical trial. This is one of those things that I think is going to cause a lot of confusion in people. I hope, given that he has a history of heart disease, that he is being monitored in some way.
President Trump said Monday that he is taking the controversial drug, hydroxychloroquine, an anti-malaria drug that the Food and Drug Administration had warned against widespread use, along with taking zinc as a preventative measure against the coronavirus.
Trump said, I get a lot of tremendously positive news on the hydroxy. And I say, hey, you know the expression I've used, what do you have to lose? I've been taking a pill every day for about a week and a half, and I'm still here.
In a statement, White House Dr. Sean P. Conley said that after numerous discussions about the drug, he had concluded the potential benefit from treatment outweighed the relative risk. Meanwhile, Conley said he would continue to monitor studies into COVID-19 treatments.
A White House staffer tested positive for the coronavirus, and Mr. Trump, who is regularly tested, has tested negative, Conley confirmed. Trump and the White House doctor directly contradict recommendations from the FDA. The FDA said hydroxychloroquine has been linked to serious and even fatal heart risks in some patients.
The largest study on the drug to date showed it did not improve the conditions of coronavirus patients and was tied to a greater number of deaths. Trump said he decided to take hydroxychloroquine because I hear good things about the drug.
This news has medical professionals very concerned that Americans will again try a dangerous misdirection treatment like his famous injection of Clorox. The president began to tout the potential of a drug combination, including hydroxychloroquine, in March, claiming in a tweet that it had, quote, a real chance to be one of the biggest game changers in the history of medicine.
Q News Tonight recommends you consult your physician before any use of this drug, or frankly, any recommendation that comes out of the president's moving lips.
You know, I never cease to be amazed by what actually comes out of his lips. I am completely shocked on a daily basis, and I shouldn't be. I should set the bar so low that I'm not surprised. I will admit myself, a friend of mine has said, try this diet pill, and I would try it. But there's so many eyes in America watching him. He has a greater responsibility to do research. And the thing is, people are throwing information at him. He's not just randomly, well, let me Google this fact. They're offering him advice, and he's not taking it.
He reminds me of one of those cartoon dogs that just jump up and down and asking for attention. Pet me, pet me, pet me. That's what it reminds me. Unfortunately, it has to do with drug therapies, a pandemic, and running the free world. Not a good combination.
I remember hearing that this was a drug that if you have any kind of heart issue could cause heart arrhythmia, which is where you get to the deaths that we were describing before. Obviously, Trump has no heart, so this isn't something he's worried about. But I do question his proposal of this for the masses who can't even get it in the first place because you can't get it prescribed to you.
Well, good evening again, America. It's 7 p.m., Tuesday, May 19th, 2020. It is time to queer up the news. We are literally out of the closet and into the headlines. So many of your important stories we are going to tell tonight on Q News Tonight. Tonight on the world's first live daily queer evening news show.
Tonight's news about the gay community and the news from an LGBTQ perspective. Are our gay stories important to you? In headlines, politics, entertainment, gay culture, travel, religion, and more. Reported by respected anchors.
Out of the closet and into the headlines on Q News Tonight. Thank you for joining Q News Tonight. We are live, so anything can happen. I told you we're live. Watch. Tonight we bring you the news of and a perspective from the LGBT community. Be sure to stay tuned as we bring you an amazingly good news story, even despite coronavirus pandemic. I'm your anchor, Al Ferguson, and this is my co-guest anchor, Misty Eyes.
Hi, I'm super excited. We have a pre-exposure prophylactic story ahead of us.
That's a mouthful.
Yes, PrEP.
And anchor Napoleon Plays.
That's funny, and that's right. We have a story as well about a vaccine. Find out what's going on with it. Stay tuned.
Let's cue up the news.
We are proud to share with you that our LGBTQ television network supports the unique live broadcast of Sunshine Cathedral's Sunday Church Service, the world's most popular LGBTQ queer religious broadcast. And we are proud of our diverse 501c3 and charitable support.
We're also proud to have breaking news as reported today by Alexa Analytics about Q News Tonight and It's Happening Out. The Happening Out television network has become the largest LGBTQ live media platform on the planet.
We are happy to report, as of today, we have the #1 live video LGBTQ website in the world at number 9,462. That's out of 900 million websites.
Combined with 2.2 million television viewers in April, we are the source for the LGBTQ community for news, talk show, and entertainment. Thank you for your confidence and thank you for your support.
So let's queer up the news. First, let's catch up on all the news surrounding COVID-19 with our quarantine quickies. The first story tonight is our daily reporting of the coronavirus facts, especially important to the LGBT community. We report on coronavirus case numbers this evening up to the minute, based on standard acceptance of 7% population representing the LGBT community. We report that the world's LGBT COVID-19 cases now stand at 344,000. America's LGBTQ COVID-19 cases stand at 108,000. Total world cases just short of 5 million cases, and the total USA cases stand at 1.5 million. We remind you that America is ground zero of this world pandemic. The USA is just 4.4% of the world's population, and today America makes up 31.5% of all of the cases in the world. That percentage is slightly lower today. We also report on coronavirus deaths. The world's LGBTQ COVID-19 deaths now stand at over 22,000. America's LGBTQ COVID-19 deaths stand at 6,445, while total world deaths is 320,000 and total USA deaths stand at 92,000. America is a third of all the COVID-19 deaths on this planet. While the USA is just 4.4% of the world's population, we now make up 28.6% of all the world's deaths. And that percentage is higher today. President Trump and Vice President Pence have said a lot of ridiculous things about testing, and especially as it relates to our LGBTQ community. So here are the testing facts. As of today, we have tested 12,331,000 test totals have been taken, and contact source tracing is dramatically lower. We move, however, the grade of the White House Coronavirus Commission to a grade of D-, and today is the highest rating yet And that is because there are 328 million Americans, and we've only tested 3.8% of the population. The medical community recommends a testing rate should be 10% for reopening. Despite what Trump and Pence tell the LGBT community, testing and contact source tracing is the #1 solution to the pandemic. And so therefore, Q News tonight recognizes our Hall of Fame, top states in testing. #3, New York, #2, North Dakota, and #1, Rhode Island, reaching the 10% goal. Q News tonight also recognizes our Hall of Shame states, doing the worst job in testing, and LGBTQ America, we hope you don't live in one of these states. That is #5 in Oregon, which has tested only 2.3% of its population, #4 Kansas, #3 Colorado, #2 Idaho, and you already know who is #1 and has been there right from the beginning.
Puerto Rico. Quarantine quickies. First evidence shown that vaccine will prove effective at fighting COVID-19. We have a video for you. Watch this.
And this is very encouraging. A company called Moderna, in the sprint for the vaccine, they've taken a little bit of a lead here because in their phase 1 trial, they found out that for some of the participants, they don't have all the results yet, early results now, but in 8 of the participants, they actually ended up seroconverting, we call it. So they basically found out that because of the vaccine, they had antibodies. The good part is those antibodies are neutralizing. In other words, they'll take care of coronavirus and prevent it from taking hold, safe and well tolerated. And they found out that they were getting levels equivalent to people who recover from coronavirus, and now we think have some immunity to it. On the side note, they also did an earlier study, or compared it to an earlier study of mice where they used the same vaccine and found out the mice actually were able to not get the coronavirus when they infected them with it purposefully.
The first hints that a vaccine can train people's immune system to fight coronavirus have been reported by a company in the United States. The biotech company Moderna said neutralizing antibodies were found in the first 8 people who took part in their safety trials.
It also said that the immune response was similar to that of people infected with the actual virus. Larger trials to see whether the jab protects against infection are expected to start in July. Work on a coronavirus vaccine has been taking place at unprecedented speed, with around 80 groups around the world working on them.
Moderna is the first to test an experimental vaccine called mRNA-1273 in people. The vaccine is a small snippet of the coronavirus's genetic code, which is injected into the patient. It is not capable of causing an infection nor the symptoms of COVID-19, but is enough to provoke a response from the immune system.
The vaccine trials run by the U.S. government's National Institute of Allergy and Infectious Diseases showed the vaccine led to the production of antibodies which can neutralize the coronavirus. It will take larger trials to see if people are protected against the virus. However, experiments on mice showed the vaccine could prevent the virus from replicating in your lungs.
And I know that they have been rushing through animal testing as much as possible because obviously getting rid of COVID, or at least managing it, is the top priority of the world and each government, or at least we think so. But I'm concerned as to how much they are rushing past those tests. Even if they're doing tests on mice, that's usually just the first. However, obviously we need this vaccine to get here as quickly as possible. So if you're somebody that can take it, I would probably volunteer to be one of the first as well.
When PrEP first came out, I volunteered to be part of the study group because they weren't giving it to you unless you were, and I heard about it. I think this is very optimistic news, and I'm super excited to see what happens.
I am optimistically skeptical.
Yeah.
The important thing, LGBTQ America at Q News tonight, we're trying to bring you the best, most accurate, factual information possible. There has never been a major vaccine developed in under 5 years. We're in month 4, so you can do the math. But I'm optimistic, but skeptical, so we must stay tuned.
Quarantine quickies. Trump's threat to the World Health Organization could prove costly to World Health efforts. The U.S. President Donald Trump's attacks on the World Health Organization are hurting its ability to protect global health. Medical experts said Tuesday as many World Health Organization member states rallied around the United Nations Health Agency, even as they urged a look into its coordination on the global response to the coronavirus.
Political sniping on the final day of the WHO's annual assembly, which nonetheless produced a unanimous resolution that backs cooperation to find tools to address COVID-19 and inspect the world's response to it. The European Union, the resolution's chief architect, urged countries to support the WHO in wake of Trump's continued attacks.
European Commission spokeswoman Virginie Batu Henriksen said now wasn't, quote, the time for finger-pointing or undermining multilateral cooperation. German Minister Heiko Maas said, together, we stress the central role of the World Health Organization in internal health medicine and called for it to be strengthened.
Health experts said Trump's increasing attacks on the World Health Organization for its handling of the coronavirus demonstrate a profound misunderstanding of the United Nations agency's role and could ultimately serve to weaken, not help, the global health.
Devi Shradlar, a professor at global health at the University of Edinburgh, said his position is for Trump's political base and meant to deflect blame for the virus's devastating impact in the United States, which has by far the most infections and virus deaths in the world.
So what we're saying is that Trump is finding any excuse to not take responsibility because he had the information first and did very little with it, unfortunately, for everyone, and all of the deaths that happened could be put on his shoulders.
He's the ultimate blame shifter, and pointing fingers at people that are actually trying to help you is not a good idea. He also hit them with a big blow of financially decreasing his sponsorship.
Well,
I'm sure hurts.
The bottom line of the situation is the attack on the World Health Organization and muting the CDC. So both internally in the United States and externally outside the United States, the president is going out of his way to deflect from science, which is a very dangerous moment.
Yeah.
We queue up our segment called Coronavirus Good News. After we finish our quarantine quickies, we like to lighten it up. We've reported all of the statistics and facts for the day, but now we want to report the things that make us smile today in Coronavirus Good News. Coronavirus Good News. 12-year-old invents COVID-19 protection device using a 3D printer. It didn't take long for Mizan Rupin Tompkins, the San Francisco 12-year-old, to invent his own solution for the problem of avoiding germs in public during the pandemic, which hit the city hard in early April. He saw his parents fumbling with their sleeves whenever they wanted to open a door, so he designed a hook-like tool and perfected the prototype on his 3D printer.
It's called the Safe Touch Pro. It also has the ability to punch numbers on keypads for whatever you are, the ATM, the cash register, or even gas stations. He's not the first to dream up such a device, but he did his market research and provided an upgrade. He makes his tool from germ-resistant plant-based plastics.
Mizan said, quote, I really made it for my parents, and now it's helping everyone. I wanted to make sure it was good for the environment and the virus can't survive on it. We love this and why it's Q News Tonight's Coronavirus Good News. Watch this.
Exciting. I was surprised how many sales we got. Yeah, I was very happy.
Mizan is demonstrating his invention at Saramonte Center in Daly City.
I think the most excitement everybody's been giving is because of his age.
His family lives near the mall.
We were basically struggling using our sleeves.
And with the device Mizan designed, they punch buttons and open doors without touching what might be a contaminated surface.
I really made it for my parents, and I feel like that now is like helping everyone.
Mizan was inspired early in the pandemic when he saw his parents using their sleeves with hand sanitizer in short supply.
Since I couldn't find it, I was just using my sleeves, but since he said, let me go ahead and print you something, and when he printed this for me, it was perfect.
After Mizan sold a few samples online, his Safe Touch Pro took off, and now he sold a few hundred, with dozens of orders each day at $14.99 each. Mizan researched others on the market and makes his tool from plant-based plastic that is germ-resistant.
I'm going to have to buy one of those. It's good news. We'd like to thank our set designer, Concepto Modern Living, here in Fort Lauderdale for making this set in this living museum possible.
Tonight we are broadcasting from our studio set in the middle of the World AIDS Museum and Education Center. The museum is in Wilton Manors and Fort Lauderdale, Florida.
We joke we're coming from the gayest place on planet Earth.
Tonight we bring you a mini sample of Q's Q&A on coronavirus and the LGBTQ community. Every Thursday night on Q News Tonight at 7 p.m., we have experts answer your questions that need to be answers.
Does insurance pay for testing? How often should I be retested?
Well, the conversation we've talked about a couple of times in terms of testing. In most instances, either the federal government or your insurance provider will cover all of your tests, and you should always ask in advance.
Simple.
Yeah.
Simple.
So go get tested.
All right.
I heard that if you don't have insurance, though, it does cost $100.
Well, at some places, I know that the ones that we go through with Dr. Howard Grossman, he waives that fee, as Al was describing before. So doctors want to help you, especially in infected communities. So find out, because it's important.
We're going to continue in Queuing Up Health by reporting a long-acting injectable PrEP proves more effective than the daily pill does. Napoleon, tell us about what's happening here.
Cabotegravir, a long-acting injectable version of pre-exposure prophylaxis, PrEP, could become the next advancement in the fight against HIV/AIDS. A clinical trial of the drug, sponsored by the U.S. National Institute of Allergy and Infectious Diseases, began in December 2016 and enrolled more than 4,500 participants worldwide.
The drug trial involved transgender women and cisgender men who have sex with men, but was stopped early by an independent monitoring board after cabotegravir was found to be 69% more effective than the current standard of care, Truvada. The study was later disrupted by the coronavirus COVID-19 pandemic.
The drug was injected every 2 months and proved to powerfully protect HIV-negative people from the disease. The injections were deemed safe and well tolerated. The injection site was in the buttocks, being a primary adverse effect in the latter group.
Jared Baiten, an epidemiologist at the University of Washington, Seattle, who was involved with previous PrEP studies, said, "It's really exciting. It gives another option for people who can't or don't want to take daily pills."
According to a March 2019 report from the Center for Disease Control and Prevention, 35% of gay men and bisexual American men are now on daily PrEP. Myron Cohen, co-principal investigator of NIAIDS's HIV Prevention Trial Network, said the agency really could contribute to the goal of ending AIDS by 2030.
Well, it's exciting news. Anything that continues to propel HIV is super desirable. If this is more effective, the initial study indicates 69% more effective. You don't have to concentrate on a daily basis. It's very, very exciting and important news for the entire LGBT community. I was astounded, by the way, that 38% of all of the LGBT community, gay men principally, are on PrEP now. That just is stunning.
That it's that many or that few aren't?
That it's that many.
Because
well, I guess
I was surprised that 65% aren't. And until this week, I was actually one of those 65% that wasn't. I wasn't on Truvada until just a little bit ago after seeing Dr. Howard Grossman, and he convinced me that the liver or kidney damage was not going to be severe enough, because that had always been my biggest fear. So somebody like myself that in the before times that was a sexually active now has more of an opportunity. The before times.
It's true. Truvada did have some side effects, including kidney and liver damage. But I agree with both of you. I think that any person, male, female, cisgender, transgender, if you have a penis that inserts your body, you should be on PrEP. When little girls turn 16 or sex age, whatever that is allowed in their families, many girls get put on the pill. And I always tell our LGBT kids, if a penis inserts your body, you should also be on the pill. And I think an injectable PrEP will be way more effective, because people do often forget their daily regime.
I don't know if I'm turned on or not. Did we have a video with that package?
No, we're moving on into Queuing Up the USA. We report tonight that a news anchor has been attacked for the crime of being gay. We have a video on this. Watch this.
Hi everyone, it's Matt Belanger. On Tuesday morning, I was on the Nicollet Mall light rail platform in downtown Minneapolis waiting to catch the train I would normally take to work. And a man who I do not know suddenly from close range threw something at my face, and it had enough force to cause some damage to my left eye, and that's why I'm wearing the eye patch here to protect my eye as it heals. Metro Transit police have made an arrest in the case, and I just wanted to post on Facebook here saying how deeply grateful I am for all of the notes and messages that you've been sending to me from people all across Minnesota. They've been coming in from across the country, in fact. It's very comforting to me to hear all of that and to be reminded of the people who are thinking about me as I work through what happened and focus on my recovery and my healing right now.
Matt Belanger, an Emmy-winning news anchor on 5 Eyewitness News in Minneapolis, Minnesota, was attacked on his way to work. After apprehending a suspect, police believe that the case is one sparked by homophobia. According to a video he posted on Facebook that you just saw, Belanger was waiting to catch the train he would normally take to work when the incident occurred.
Belanger said, "A man who I do not know suddenly from close range threw something at my face. It had enough force to cause some damage to my left eye, and that's why I'm wearing the eye patch here, to protect my eye as it heals."
After a visit to the hospital, he was told he had suffered a corneal and ocular abrasion, which could lead to permanent damage. After receiving surveillance camera footage, the officers found Venny Jerome Williams, who Belanger later identified.
While in police custody, Williams made statements indicating that he assaulted the anchor because he perceived that he was homosexual. After news broke of the attack, Belanger has received notes and messages from viewers that he calls very comforting.
It's disgusting to me that in the year 2020, still hate crimes are so prevalent. We talk every day or weekly, at least, in the very minimum, that the trans community is such a big target. I'm actually surprised that a gay person would be attacked for walking down the street.
Yeah, I mean, I have pup friends that exist in Minneapolis, in the Twin Cities, and it's unfortunate that there are still people out there that are doing this, that are on Grindr and finding ways of attacking other people. Hopefully we can come to a greater consensus, but that just goes to show you that we're divided as a country, and that's being replicated even within our own community.
Well, when you exhibit hate in the LGBT community, karma is a bitch because of all of the people to attack. This noted news reporter in Minneapolis was probably not the best choice on the planet.
Yeah.
We continue tonight by ending tonight's broadcast with the big finish. A short story mentions of LGBTQ news or news with a gay perspective. So here we go. First on Q News tonight, the big finish. A judge denies pharma bro Martin Scarelli's delusional request to leave prison to fight COVID-19.
The only way this guy could be more unlikable is if he kicked puppies. And I'm not even sure if he didn't do that.
I'm sure that this clown had if he had his way, COVID-19 treatment would probably cost thousands of dollars.
Now, if we could only get this judge to pass judgment on Donald Trump, maybe our country would be just a bit more sane. The big finish. Freddie Mercury put Princess Diana in drag to visit a gay bar.
I wasn't even born when this happened. Life is so unfair. This is probably the gayest story that we have ever done. I was born in the wrong time, except for video games and all that. That's awesome now. But I mean, come on. Drag, Beanie Baby dolls, being a princess, calling him Mr. Fahrenheit. Oh my God. That's everything I ever wanted to be.
Deep breath, deep breath. You weren't born when Princess Di was alive?
I was born when she was alive, but barely. I remember the whole chase before.
You just called it Trumpism.
It was... Okay, wait. I think I saw this movie, though. Isn't it called The Birdcage, right?
Yeah.
They put somebody in drag to escape. But I think it's amazing. I think this is beautiful. I think this is love. And only someone as amazing as Freddie Mercury could sneak out royalty undetected and leave a story for us to talk about decades later.
It's sad that Princess Diana, arguably one of the most beautiful women anyone's ever seen, looked like quite the charming young man that night.
I want to see pictures.
Gosh, when you've got it, I guess you've got it no matter what sexual identity you have.
I'll make a supersonic man out of you.
Right. The big finish. J.K. Rowling, she's at it again, continues her bad habit of being a horrible transphobic individual on Twitter.
Okay, I was Harry's age growing up. He always seemed to be in first year when I was in first year. He graduated when I graduated. And then my dad died in 2007, and I read all of the books finally. Miss Rowling, please stop ruining my childhood. I still have a robe and wizard hat in my closet. I'm pagan. I actually have a wand. And your tweets make me ashamed to love your series. Except for when you have Freddie Stroma in it, because he is one remarkable dancer, and he was great in your movies too, but let's just think of him dancing in underwear for just a moment.
Wait, where did we go? Are you...
Oh, I wanted a video, but everyone would have gotten lost.
He's in cosplay.
Oh, he's in cosplay right now. Got it.
You know, the saddest thing for me is that the woman who inspired millions of children to be good to each other, to include each other despite all of our differences, and stand up against those who would oppress us, is now dishing out hate speech herself.
Rowling, I love you. I love Harry Potter. I have the robes. I'm a geek. Don't tell.
The geek in the pink.
Many have compared Voldemort with Harry Potter to a magical Hitler. I wonder who is going to write the book about the magical Rowling. We continue in The Big Finish by reporting Nancy Pelosi calls Trump morbidly obese.
Donald Trump is definitely morbid and obese. He just isn't literate enough to understand the words. So, Fat God asked him to move out of the way so there could be light.
Ouch.
Fallen joke.
Okay, I don't believe in fat shaming, so I will not fat shame the president. But if he's morbidly obese, I will be Googling gastric bypass after the show.
As a man who used to weigh 500 pounds, I also don't fat shame, and I can't make fun of Trump's weight. In good faith, however, I would have to say that you probably could use a few less trips to a place that I no longer go to. Fast food, McDonald's, Wendy's, Chick-fil-A. That's all I got to say about that.
Yeah, you eat healthily now.
The Big Finish. No Context Tuesday. Lena Dunham claims she ate an entire cheesecake after doing poppers.
I'm not sure if this is the Jewish accomplishment I wanted on the show, but I'll take it. Then again, I can't say inhaling bleach and consuming cheese is any sort of accomplishment. Maybe she should be condemned to 40 years in the desert. Anyone who's done poppers, it burns your throat. Why would you then eat trash?
Girl, I don't need poppers to eat an entire cheesecake. First of all, I am not impressed. But I will say in the land of not so long ago, let's say one time at band camp, I did some poppers, but I can't tell you what I ate.
I guess it relaxes more than one hole in the body, but still, to imagine one could stuff all that cheesecake in there. Am I getting this right? I guess I disagree with Misty. I'm kind of impressed. The Big Finish. Happy 28th birthday to Sam Smith.
Sam Smith got their heart broken by the love of their life, went on to write Stay With Me, and thanked the man who broke their heart for the 4 Grammy wins due to the song. What a legend. Why am I so emotional? Won't you stay with me?
You're giving it a country twist and it's messing me up.
Come on, join in!
The song, but
we had a
you
thing!
countrified it. I'm sorry.
I'm just from the
I
South.
can't Napoleon.
I'm just from the
I'm
South.
sorry.
It's done.
But did you know that
over.
Sam Smith is on the transgender spectrum and they identify as non-binary and they use they, them, their for their pronouns. They might be the most famous genderqueer voice in the world. Happy birthday, darling.
Stay With Me, and I'm not going to sing it because
Won't
neither
you
of my anchor partners can sing it
with
either,
me?
is one of the most beautiful songs I have ever heard.
Yes.
And it still blows my mind that Sam Smith is only 28 years old. He's so much younger than Napoleon. What a beautiful soul. And happy birthday, Sam. And I agree with Misty, darling.
Darling.
That's it for today's news and for Al Ferguson on Q News Tonight for the LGBTQ community on the world's first daily LGBTQ evening news show.
Remember, if it's important to the LGBTQ community, it's important to Q News Tonight. But we do need your help. Click subscribe on YouTube and share this news.
We are literally out of the closet and into the headlines. This is the only source of live LGBTQ news in the entire world, and your community needs your support.
You are not alone. We will get through this crisis.
We are here with you, and this is Q News Tonight.
So thank you for joining us. I'm Al Ferguson, and on behalf of Misty Eyes and Napoleon Plays, we'll see you daily at 7 p.m. tomorrow night. Good night.